While we're welcoming everyone, will the panelists rename yourselves to include your organization so everybody can see?
I think we'll give a couple of minutes more and then we can get started.
Okay, so let's begin, Sanjana and team, as people are logging on. And as people are logging on, it would be fantastic for everyone to introduce yourselves, where you're joining in from in the chat. And if you can select to everyone, so that everybody can see your chat as opposed to the default, unfortunately, which is just hosts and panelists. Well, welcome everyone. It's my pleasure to, kick off this COVID-19 learning series that we've been collaborating with Grand Challenges Canada. It's my pleasure to introduce you to our co-host and the moderator for today's event, is Sanjana. Sanjana, if you want to introduce yourself.
Sure. Hi, everyone, and good afternoon, good evening, good morning to all of you joining in from all over the world. Welcome to this conversation. My name is Sanjana, and I'm the Program Officer for Saving Brains at Grand Challenges Canada, where I manage both our investments and our Saving Brains community with the help of our wonderful platform team, who you'll be hearing from today. I'm calling in from Toronto, which is the traditional territories of the Haudenosaunee, the Wendat, the Anishinaabe, and the Mississaugas of the Credit, the people who have stewarded this land and the relationships with this land that have allowed all of us to thrive. I'm both an immigrant and a settler in Canada, and I hope to bring some of this lessons that I've learned from the Indigenous people in this context to stewarding some of our conversations today as well. So excited for this discussion, and I think we will learn a lot together.
Thanks, Sanjana. So just to kick us off, we welcome questions in the Q&A, and we'll have a Q&A section. But generally, if you can keep questions in the Q&A box and not in the chat, that would be great. I'll begin. So Sanjana, if you want to screen share.
Yeah.
So about a year ago, ECDAN embarked on a COVID-19 learning journey in collaboration with Grand Challenges Canada, Harvard University, and Stellenbosch University. And we undertook a few key activities. And today we'll share some high-level findings from two recent research activities. One is we took stock of published peer-reviewed research conducted to date on early childhood development in low middle-income countries. So mainly from January 2020 to October 2021, so over a period of 2 years. And the intention was to get a sense of the nature, quantity, and scope of the research that had been conducted to date. Sanjana, are you able to make it full screen, or and you can just yeah. And remain on the first slide, and I'll indicate when to change. Yeah, and then the second one, second work that we conducted was we took a forward-looking lens to see what research, and then from there we wanted to see what are the key research questions and priorities that need to be addressed on COVID and ECD moving forward through a survey with members of ECDAN as well. So to begin.
Sorry, are you seeing my screen or no?
We're seeing your screen, but it's not full screen. So if you can just click on the little presentation.
Yeah, it's not working for some reason. Let me try again.
Okay, no worries. I'll just continue given that we have time. So the first work, which is the scoping review, we did a rapid scoping review where we looked at the nature and scope of different domains of nurturing care, looking at child and maternal health, nutrition, security, safety, early learning, and responsive caregiving. The key inclusion, perfect, Sanjana, that works. The key inclusion criteria was we looked at research that had to be published in low middle income countries between the dates of January 2020 and October 2021. They were publicly available and peer reviewed, more on the methodologies available in the report. And we initially screened several thousand articles and narrowed it down to about 411 articles according to the inclusion criteria. And what we see here is there was a slow progression of publications in the first 6 months of the pandemic. But from around October 2020 onwards, we see an explosion of articles, around 30 articles or more a month, and increasing a lot more in the last 6 months last year, which meant it was a lot to keep for researchers and practitioners alike to keep on top of. So in the next slide, we see that within the group of, actually, could you go to the next? Yeah. So in terms of, sorry, Sanjana, previous slide, apologies for this. So within this group of 411 studies, we did a deeper study, and asked questions of where were these studies conducted, the types of topics and questions, and with whom. So primarily pregnant women, studies targeted pregnant women and children up to the age 18. Less than 10% of studies focused on infants and young children specifically. Mostly it was focused on health and mostly included mothers rather than fathers, with only one included study focused on fathers. Next slide, Sanjana. So as we see this, we see that more than 60% of studies were conducted in upper middle income countries, with a minority being in lower middle income countries and the smallest proportion being in low income countries. And so there was a big gap in research in low income countries. We see that the research was, especially at the start, was heavily dominated by research in Asia, and a lot of initial research in that one region. Approximately a quarter of the data came from China, followed by data from India. Next slide. So what were the studies? What were the key topics? And what we did was, when we reviewed the articles, we coded it, with the different nurturing care themes. And for ease here, we just collapsed health and nutrition, safety and security, and early learning and responsive caregiving together, just so that we can see. But you see that the majority of the research, nearly 85%, most of the studies address issues of maternal and child health. In contrast, very few studies related to early learning and responsive caregiving, with only 7% looking at safety and security related topics. So what were the main topics that were covered? under each. So for health and nutrition, there were sort of two big topics that were primarily covered. The first one looked at trends in maternal health, especially maternal mental health, especially pregnant women, new mothers, generally observing that, depression and anxiety increased across the board, and it was fairly consistent in these studies. The second key topic was looking at determining and identifying trends in access and utilization of child and maternal health services during the pandemic period. And again, we have consistent findings there across the board where as expected, there was a decline and decrease in access and utilization of services across countries, especially health services like immunization, postnatal care, and child health visits. For the next category, which is on early learning, we see that there were more diverse topics covered compared to health. However, comparatively a lot fewer articles, and they tended to document usually the attitudes and perceptions of parents as well as teachers, and in some cases children, pertaining to the shift of going from in-person classes to remote learning. And some also looked at the trends in terms of pre-primary access during this period. Very few studies, maybe 2 to 3, had responsive caregiving as the main focus, and that was a key gap in the data. For the last theme on security and safety, there were sort of 2 predominant themes. The first one tried to measure the prevalence of violence against children and mothers, and a lot of documentation of the challenges in terms of documenting violence against children and mothers during the pandemic conditions. And the second was around child protection responses. And the general trend, as expected, was that reporting of suspected maltreatment had declined, especially during school closures, because of diminished contact with teachers and other officials who would normally be reporting on this stuff. So that's the key themes of what topics were covered. So now, Sanjana, if you can go to the next slide, please. So in terms of looking at the how, what we found was when we asked the question of what were the key types of study methodologies, designs, well, we find that most of our information during this period came from quantitative studies, very few qualitative studies, and again, that was a key gap. So the information that we mostly have in the published literature was mostly coming from one-time surveys, cross-sectional surveys, and collected from data primarily from parents and caregivers, so self-report data. All right, so with that, Sanjana, if you can stop the screen share, and I will share a recording from another researcher who worked with us on the studies, who will share insights from the second component, which is on the survey data. So this is Dr. Carrie Prue, who is a researcher and collaborator on this.
That's the research that was conducted to date, up to October, the end of October last year. We then kind of shifted the focus and said, now going from here, what are the key research, like what are some questions and research topics that members of the ECDEN community would like to see being addressed in future research going forward. And so a survey was sent out to members of ECDEN. This took place in December of last year, and it was asking them to identify priority research themes using the same domains of nurture and care, and there was a list of 15 possible research themes, and respondents were asked to rank the top 3. They could also add additional themes or kind of overarching topics if they weren't in that predefined list of 15. And the questionnaire was completed by 98 respondents, covering 47 countries, and most respondents resided in low and middle income countries. Most respondents were professionals working in the ECD space, like pediatricians and ECEs, and there were also then researchers. Those were the two kind of key, looking at kind of the roles of the respondents. And again, the results from this are available, like that outline all of the different research, that going through the list of 15 research topics, how they kind of ranked, and illustrative research questions that were provided for each topic. I'm just going to narrow in on the top 3 research topics that emerged from the questionnaire. So the first one was there was a need for more research on the most frequently selected research priority was to identify opportunities to support early childhood education and childcare during COVID-19. So respondents in particular highlighted the need for future studies on the effectiveness of remote and home-based learning for pre-primary children under age 8, and also more research on implementation research, considerations for implementation, and how to scale up, like effective practice or effective programming, remote programming for young children, which is obviously carries unique challenges compared to older children. So that kind of emerged, and as the number one, like the need for more research on strengthening early childhood education. And as we saw in that first phase, that there wasn't, to date, there hasn't been as much research on opportunities for early learning. The second one was, and again, it links to that initial, relates to that initial scoping review. We saw very little research related to responsive caregiving. So research on responsive caregiving emerged as like the second key research activity. And in particular, respondents sensed that it was a need to understand the effects of the COVID-19 response, like lockdowns, quarantine. So the effects of such on parent-child interactions, beneficial, perhaps harsh parenting interactions, to get a better sense of like how pandemic conditions impact parent-child interactions and responsive caregiving. So in addition, there was, respondents suggested a need for studies to evaluate the effectiveness of a range of parenting programs that can support responsive caregiving and stimulation during health emergencies. Then the third sort of priority research question was related to mental health, which is a bit, because that was, as I said, one of the main research questions that are research topics that emerged in that first phase. So I'm a bit surprised to see that, request or like this more research on mental health during COVID-19, but in particular, actually what came out from the responses from the survey was it wasn't necessarily more research on looking at prevalence of maternal mental health, but in particular looking at children's mental health during COVID. So not which we saw in that earlier phase, which the focus was really on mothers. So the research priority was leaning towards more research on children's mental health during the effects of the pandemic on children's mental health, but also a need for research on understanding the consequences of poor maternal and paternal caregiver mental health and child development, and also need for research on effectiveness trials to determine scalable interventions to support caregiver mental health during future health emergencies. So that brings us to the end of the presentation. Thank you so much for your time and your interest.
All right. So that brings us to this webinar here today, where we really want to, now take a little bit of a deep dive into some of these studies and findings and hear directly from the voices. So with that, I'm going to introduce you to Ana Luisa Pena from Harvard University, who has been engaged with a different scoping review, and she will share some of her global findings as well. Over to you, Anna, and I think you have about 7 minutes. And so if
Hello.
those of us not presenting can turn off our cameras, that would be great.
Hello, thank you very much for the invite. I hope you can all hear me, and I apologize in advance if my internet is a bit flaky. So I would like to present the main results of our scoping review regarding the impact of the pandemic on basically three domains: the maternal mental health, early childhood development, and parental practices worldwide. So the main purpose of this review was to map the current state of knowledge concerning these three domains in order to identify important gaps and potentially inform future research and policy. We did this as part of our cohort study in Fortaleza, Brazil. So we thought it would be a good idea to map out existing evidence first to see the state of the art so of the field. So publications were eligible for inclusion if they contributed with at least one of the three domains, and they refer to the population of interest in our case, and published between January 1st of 2020 and June 9th, 2021, when no language limits were applied. So we found 2,308 eligible publications, out of which we ended up selecting 537. That's quite a large number. The majority were 82% were primary research studies, 10% were case reports, and 8% systematic reviews, 8%, sorry. So given that case reports, given that it's a nascent field, right? And so people were trying to figure out the impact of COVID on basic health domains. So we thought case reports were an interesting inclusion because they might inform future research on these areas. That's where the research questions are born in a way from clinical practice in certain areas. So that's our rationale. So this is, I'm going to echo the last presentation in that we saw an explosion of publications around July 2020, and it only increased from there. And I think this figure represents the overwhelming situation of publications around COVID in all areas. And I think our main effort was to separate quality from quantity. And so just a quick overview about, of course, about the geographical source of primary research. This applied only to primary research studies. So the vast majority came from high-income countries. In fact, 63%. 28% came from upper middle-income countries, 8% from lower middle-income countries, and only 1% from low-income countries. And that by itself is alarming in terms of how much we don't know in terms of the interaction of the pandemic in diverse settings. So in terms of the main characteristics of empirical research studies, 67% employed a cross-sectional design, which is understandable because it wouldn't be reasonable to expect longitudinal data to happen as fast as the pandemic was unfolding. So, but that has implications for the nature of the research question at hand. So, for example, etiological questions instead of descriptive questions tend to suffer from cross-sectional design or convenience sampling methods, which were 34%. And through open access links disseminated through social media platforms, that was very common. And more than half use validated instruments of measurement. And yeah, so that speaks to, I guess, some of the quality of the data in terms of what questions they were trying to address. So what I'll do now, my strategy is, there's a lot of information to unpack. So what I'll do is I'll focus on the main evidence gaps of the impact of the pandemic, and specifically on early childhood development. And so by domain. So we'll start from health and development. For example, the main gaps are added morbidity and mortality, burden of COVID-19 and other diseases. especially in low and middle income countries undergoing humanitarian crisis, the current state of the developmental goals in terms of immunization delays, the impact of tele and virtual healthcare on ECD, stratified by presence of neurodevelopmental disorders and or chronic illnesses, and the level of access and quality of mental health care services. So impact on education in terms of quality and pedagogical milestones stratified by gender and ethnicity. So these stratified analyses were rare to find. So, and this is most informative, right? Like getting an average might not speak to the reality of any specific population. So cross-cultural and country-specific impact on social emotional development based on longitudinal data stratified by socioeconomic status, gender, age, ethnicity, differential impact on health status and developmental milestones concerning children with neurodevelopmental disorders and or chronic illnesses. Please stop me if I run out of time, because there's a lot of information, but I'll keep going. In terms of the relational domains of the caregiver, mainly caregiver and child, most research was made in a dyad framework instead of a more structural dynamic across multiple caregivers. So we're talking about harsh parenting and abusive parental behavior reported by subtype, in terms of psychological, physical, sexual abuse, the added impact of bereavement stratified by levels of support and access to mental health services and caregivers' mental health status, overall estimates of incidence and impact of orphanhood on the health and development of children, stratified by presence of secondary or tertiary caregivers, institutional resources, children's rights policies. In terms of demographic and economic characteristics, so the main gaps were developmental milestones and educational gaps, impact on food insecurity in terms of quantity and quality of dietary patterns, the impact of financial strain on family health insurance, and in terms of infrastructure, environmental and social cultural aspects of the development. So the association of ECD and living conditions, right, in terms of distal and proximal areas in terms of this wider city and neighborhood infrastructure, or community and safety and security, housing structure, overcrowding, hygiene conditions, access to recreation activities, schools, daycare. A lot of research around the impact of COVID on the mental health of children we found spoke to the impact of the disruption of going to school, of the socialization in school. But again, it's only the tip of the iceberg, right? The interaction between the pandemic and natural disasters, industrial disasters, war and conflict, climate change, forced migration, trauma and violence, cross-cultural and culture-specific relationship between ECD and community social capital and social stability. As we kept saying, this is not one global phenomenon. It's a very specific, it's a syndemic, right? It's like the result of a number of interactions in the impact of the pandemic on a specific group, population group. Well, sorry, yeah.
Thank you, Anna.
Thank you.
Anna, that was really useful. Thank you so much. And for everyone, Anna will still be around. So if you have any further questions for her, again, please feel to drop it in the chat, or we can have a specific session around some discussion around these outcomes. Slides will be shared, and I'm sure there'll be some of that was really important information for us. And I think it leads quite nicely into our next segment, which is really trying to understand, what happened during the pandemic on the ground with folks who were leading intervention to reach children and families. So our next section focuses really on getting the innovator voice. What did the innovators do? How did they innovate to reach families and children? And so I will reach out, I'm going to stop talking now, and I'm going to ask Nii from IO2 to share a little bit about what they learned from their experience in the pandemic. Nii, are you here?
Yes, I'm here. Can you hear me?
Yep.
Thank you, Sanjana, for your presentation. Yes, definitely a challenging time for all of us. Lots of lessons learned as from any challenge period, but I would say, can you see my screen now?
No, we can see your notes now. We can just show, yeah.
Are you seeing it right now?
Yeah, but we can see also your section. Yeah, perfect. Perfect.
I don't know what's going on.
Nayi, just share it again.
Yeah.
Yeah. Can you see it now?
Yeah.
Okay, good. Thank you. So yes, definitely lots of lessons learned, but I would sum them probably in these 5 first lessons that I'm going to share with you. First and foremost, the importance of keeping our spirits alive and maintaining playful disposition. And of course, not only ours, but making sure teachers and parents also had that playful disposition to embrace the situation from, yes?
Nayi, I don't, Sanjana, can you see Nayi's screen? Maybe it's just
No,
from.
unfortunately, I can't see it. Yeah.
Oh.
I mean, Nate, just feel free to speak to the points, and then we can send the slides out afterwards as well.
Yeah.
Yeah,
And
sorry.
it would be great for those who don't know AEIO too, if you can begin by just sharing what AEIO is and where they work and what they do.
Okay, thank you. So AEIO is a social organization working for children's development to transform communities through children's development. So we basically operate some centers in different cities and municipalities in Colombia. We also train other teachers in the use of different strategies to strengthen the quality of their educational practices. And we also share our knowledge to, well, it started with the pandemic, but it's also one of our goals right now, and is to share our knowledge with the rest of the people, basically through the digital channel. I'm actually the person leading the digital strategy for AIO2, and I'm going to share with you like the different lessons that we learned over the pandemic. So first of all, as I was saying, very important to keep our spirits alive, to maintain playful learning, not only ours, but also to make sure that teachers and families were coming from this place of positivism and love to embrace the situation, so that they would make sure they would be able to make the best out of a very difficult situation. Also to understand homes were not schools. Homes are unique contents where materials are different, relations between children and parents are different than relations between children and teachers. Also, routines are different. Parents do not necessarily have the same time. I mean, in some cases they do, but most of the cases they don't have the same time that teachers have to spend with children. So we needed to understand and validate that homes were different from schools, and then adapt to those differences, and create playful routines around the existing routines in the house for children. Also to be flexible and to be present. I think that this was one of the most important yet sometimes difficult things to do, just because teachers needed to also understand that for families it was important to so for teachers was important to adapt to families' schedules, to families' needs, and it was also important to understand that families also needed our constant presence. So for example, not only give them ideas on how to share experiences with children, but constantly ask how did those experiences went, what worked, what didn't work, were children engaged, were they interested in what we were proposing, and if they were not, then what could we change and adapt to make, to offer better experiences for children. Also to ask, and that takes us to the 4th lesson, to work with families, to ask parents about themselves, not only accompany them to accompany children in their development process, but also to accompany parents in their own challenges, in their own needs, to talk to them about their frustrations, to hear what they needed. And that required not only our teachers to be present, but also nutritionists, psychologists, other different other different people from our team, and in some cases also to make connections or partnerships with other organizations that could help us better serve parents and families and caregivers, which also took us to the fifth lesson learned, and which involved developing new strategies to reach families. So that for us meant going digital. We launched a platform that I'm going to share a small qualitative study that we have, the results from a small qualitative study that we have shortly. Well, we launched this platform that was for free and that had hundreds and really thousands of contents to inspire both families and teachers to better engage with children, to promote play in their experiences, to use the materials that they found at hand in their houses, in their environments. And we also even created a pilot course, an e-learning course for teachers to strengthen their knowledge and to strengthen their competencies and abilities in having these experiences at the distance with children through, a screen, communicating through a screen with children. So that was very interesting, and that also helped us learn that we also need to use the tools that families are already using, which means not only use, of course, the ones that we think that they need, but really hear, parents and really hear teachers. And so we started using also not only the platform, but also channels such as WhatsApp, with WhatsApp groups where we were able to communicate with families and parents. Phone calls for those who didn't necessarily have internet access, even radio for some communities that really have had no connectivity, and in some cases also social media, because we recognize the use of social media among our families and teachers as a sourceful tool to also reach them. Now I want to share the yes.
We've run out of time for your section, but
sorry.
That's okay. I think that was a really interesting example of how you pivoted to reach children and families. And I know you wanted to share a little bit about the evaluation as well. Maybe feel free to drop some of the insights into the chat so people can see what you all studied and what you learned from that process. I'm gonna call on Isang from Parenting for Lifelong Health to come on next and share a little bit about their experience as well.
Thank you, Sanjana. Can everyone see my screen? Can everyone hear me and see my screen?
We can hear you and see your screen, yeah.
Right, I know I have limited time, so I'm going to dive right in. Hi, everyone, and thank you for joining us today. My name is Isang Awa, and it's a pleasure to be here. Thank you, Egden and Serving Brands, for the opportunity to present. I'm presenting on Innovative Voice, Parenting for Lifelong Health, PLH for short, and focusing on the digital interventions that have been developed from the PLH programs. About 1 billion children experience violence globally each year. This has immediate and long-term effects on their development and well-being, as harsh parenting is associated with poor child development, behavior problems, juvenile delinquency, crime, drug use.
Sorry to interrupt you. Sorry to interrupt you. Can you make it full screen? I think we see it not yet in presentation mode.
Oh, gosh. Oops. I'm not sure how to do that. Let's see. Oh gosh.
Yeah. So
is it okay now?
No, just click on, where you see the minus sign, the icon right next to it. If you just click on that.
Oh, okay. I hope is it okay now? Right. It's okay now, right? Shakifa, is that okay?
Yes.
Okay, great. I hope that doesn't take away a minute from my time. Okay, I was saying that about 1 billion children experience violence globally each year, and this has immediate and long-term effects on their development and well-being, as harsh parenting is associated with poor child development, behavior problems, juvenile delinquency, crime, drug use, family violence, school failure, and poor health. However, there is evidence that parenting programs help parents learn skills that are useful to them. And the benefits of parenting programs include improved mental health for caregivers and children, children, improved family relationships, violence prevention, and responsive nurturing. There are few available evidence-based programs for families in low middle income countries. So to address this gap, Parenting for Lifelong Health, PLH, was developed as a suite of open access parenting programs for parents of 0 to 18-year-olds. These interventions were developed through a collaboration between academics, international NGOs, and community partners. They aim to reduce the risk of child maltreatment and improve child well-being. And they have been tested in 12 randomized trials and found to be effective. And they were originally delivered through in-person facilitation. So these are the core principles of PLH: evidence of impact, scalable, low-cost, open source, adaptive, and locally relevant, equitable partnerships, and empathetic. So as we all know, when COVID happened, it brought with it anxieties, illnesses, job insecurities, financial hardships, loss of loved ones, and so much stress for everyone. But for parents and caregivers, there was an additional dimension. Most parents and caregivers had the added responsibility of looking after their children round the clock, and this in a lockdown situation. Naturally, this further added stress. So to assist parents and caregivers with children aged 0 to 18, manage better during the pandemic, the PLH team, in collaboration with UN agencies and other partners, developed simple, playful, colorful, easy to read, quick tip sheets. You can see a sample right here: keep calm and manage stress. These tip sheets offer tips on building positive parent-child relationships, managing difficult behaviors, talking about COVID-19, reducing stress and conflict, and more. With these tips, we also created social media kits, radio scripts, videos, audio messages, faith-based resources, and even tips for caseworkers that were delivering these resources. And they were disseminated as printed booklets and posters through public service announcements, phone consultations, parenting webinars, radio, social media, and on television. And to date, they have reached over 210 million people. Moving from in addition to that, the PLH team have further created digital parenting interventions using evidence from the PLH programs. And these are Parent Text, Parent App, and Parent Chat. I would have loved to speak more about each of them. Maybe I'll just touch a little bit, and if I have time at the end, speak a little bit more about each of them. Parent Text is the delivery of PLH as interactive text messages through a chatbot on platforms such as WhatsApp and Telegram. And Parent App is the app-based version of the PLH for Teens program. It is an Android mobile phone. But it's been developed for offline use. So once it's downloaded, users can use it without data or Wi-Fi. We also have Parent Chat, which is a PLH program delivered through social messaging platforms like WhatsApp and through Viber to parents of children aged 2 to 17. The WhatsApp groups usually have about 8 to 15 parents and a facilitator who delivers the program through 2 weekly sessions. These interventions have been piloted in different countries and to test the acceptability, relevance, and usability, and they'll also be tested through randomized trials. And right now I'm going to talk about I want to talk about the the Ukraine parenting resources. So a few months ago, when the Ukraine crisis happened, again, the PLH team, in collaboration with UN agencies, decided to develop resources to support parents. And we have tips for parents to help their children feel safe and supported, and tips to help parents manage their own feelings during this stressful time. We also have tips on preventing child trafficking, preventing child sexual violence, and helping children when someone they love dies. The tips have been translated into 17 regional languages, including Ukrainian, Russian, and other languages, and they've been disseminated through our different partners, organizations in Ukraine and bordering countries, and local NGOs. In addition to sharing them as social media squares and PDFs, they have been shared as videos on the Ukraine Parenting YouTube channel that was created as a quiz on the WHO Viber platform, and as faith-based resources through our partner organization, our faith-based partner organization, World Without Orphans. We also have them through the QR code, you can get to a parent to the website where you can see the resources. If you have an Android phone, please open to your camera and then go there you'll see the link to and then focus on the QR code and you'll see the link to the Ukraine parenting website where you can see these resources. Please help us to share them with those who might need them. I know I may not have much time to speak so much more about this. So as this slide shows, we are moving towards systems level approaches rather than specific programs. And even though the delivery methods may be different, the programs all fit together and are evidence-based. Finally, I want to speak about the global initiative to support parents. So PLH, in collaboration with the WHO, UNICEF, the Global Partnership to End Violence Against Children, and of course, the Early Childhood Development Action Network came together to form the Global Initiative to Support Parents, that's GIST for short. And the vision of GIST is that by 2027, all parents and caregivers that need quality, evidence-based parenting support will be able to access it. And we believe that through our collaboration and with the resources, different resources that we have developed, we will be able to support more families, reduce the risk of child maltreatment, and improve child well-being. Thank you for listening. If I still have a little time, I don't have any time left.
No, you've gone over, Sang. I'm so sorry.
Thank you for listening. I welcome your questions, comments, suggestions, and any feedback you may have. Thank you.
Thank you, Sang. Thank you so much. That was really interesting. And I think just a point to note how we take the lessons from our experience with COVID-19 and apply it to other emergencies and future conflicts as well. I think that was really wonderful to hear how you've done that at Parenting for Lifelong Health. I'm going to turn it over now to Chavi from Mobile Crashes. So Chavi, if you're here, please come on video, and then we can hand it over to you to hear about your experience with COVID and what you've learned from it.
Thank you, Sanjana. I'm very happy to be here. Hi, everyone. And I thank Saving Brains and ICTA and ISA. Mobile Crashes is an organization which has been working since last 53 years on early childhood development. Our vision is to provide a just and a caring world for each and every child. And how do we do that? We have running programs where we run crashes in various parts of country. We are right now in 14 states in India. We have been in 22 states, and our reach has been there. And we have currently 3 state partnership with government of 3 states in India. We also have a huge department of capacity building where we build capacities of various different CSOs who work on early childhood development. We incubate them, we develop their capacities to run similar services and programs. And very importantly, our third department is for advocacy with the government on every level, from municipal to so local to state to central level, to work closely with them, give inputs on policy change and for keeping a child in the center. So that's what we do. And what we did in pandemic. So just before pandemic, Delhi had some riots also in northeastern part of Delhi. So we responded to that also. And then immediately, of course, the pandemic hit us in early 2020 and then 2021. And how did we respond? So to start with, before the government announced that it's going to be a lockdown, we prepared our frontline workers. We gave, through them, we supplied all the nutrition for the next 15 days to the families whose children come to our centers. We asked our frontline workers to be in constant touch with the families. And then within a week, the lockdown was announced, and 60% of the 60 people out of 130 are in the office. So that means they're not the frontline workers. So what we did was we involved we divided them into different regions of the country. So north, east, southwest, and we made teams. So this team was just not program. It had people from supply. It had people from finance. So various all departments came together, and we started. They were responsible for handling the centers which came under that region. Why I mentioned was the rights was because during that time we realized how important the supply distribution chain is. So if the supplies is sorted, your nutrition will go to the families, to the children. And we already had that in place. So supplies across India went throughout, even during the time the entire country was in a lockdown. We didn't go physically that time there because everything was shut, but we had a mechanism where the distributor would send the nutrition with COVID precautions. The community will take the nutrition and supply to the families. We documented it by taking pictures and keeping the track of the families who received it. That was properly maintained. So another thing that really worked for us was that we have a very strong community engagement program. We have community leaders who are already in place in the community. So they would be the one who actually expanded the program. So they would take the nutrition form that take it to the family. So the whole part of supplying to the family from the time the nutrition hit the communities, that's what was taken care of by them. And then immediately, I'm talking about early April 2020. And within April, we devised a remote learning program for children, where we realized the parents here are the people who are the next to the child. So the children's education should not get disrupted. So once we secured their nutrition, came their continuity of their education. So this was a very simple education program where we would call, our frontline workers will call the parents and give them activities for the next couple of days. And then henceforth, which was based on basically a curriculum which we already have for 3 to 5 year old children, and a stimulation program for under 3s. We devised the same one, very simple in that sequence. So we ran that. Alongside, we continued working with the networks and CSO partners who do the advocacy, meeting them through Zoom, and how do we take this forward, because a lot of disruption of government services happened, which were available for our children. So that was, yes.
You're
sorry.
out of time. I'm so sorry. I don't know if you want to again finish up by dropping some points in the chat, but we do.
All right, sure. Thank you.
Thank you so much for that perspective. I think it was it's really important to think about how we are leveraging many of our networks, like you said, to reach services outwards. I'm going to turn it now to Jasmine Lam from the Saving Brains platform team, who will now share overall some of the reflections that and lessons that we learned from working with innovators during the COVID-19 pandemic. So Jasmine, to you.
Great. Thank you so much, Sanjana. So my name is Jasmine Lam, and I'm joining from the Saving Brains Learning Platform team, and it's a pleasure to be with you all here today. So in September 2020, we developed a case brief on how 4 early childhood development innovators responded during the COVID-19 pandemic. And the 4 innovators are AEIO2 in Colombia, Mobile Crash in India, both of whom you just heard from Nehi and Chavi, and then also Anna Accra in Lebanon, and RTCCD in Vietnam. So each of the innovator teams, they developed their own unique responses to support families during COVID-19 that were creatively tailored to their own community's contexts and needs. So there was definitely no one-size-fits-all solution. At the same time, we did observe 5 common themes across the cases. So in the next few minutes, I will elaborate a bit more on each theme. So first off, we observed that innovators were not focused on simply sustaining their existing program as it were before the pandemic. Rather, each team identified and responded to the challenges that families faced writ large. So for example, as Chavi was talking before, Mobile Crash, which ordinarily provides service in childcare centers, they became directly involved in organizing food distribution to communities, in addition to adapting their in-person curriculum for remote delivery. And then second, to develop a unique response that's tailored to their own community's context, innovators conducted assessments to truly understand families' new circumstances under the pandemic and their priorities and capacity to access services, in particular access to technology. So for example, the RTCCD team in Vietnam conducted a systematic phone survey of all the families that they served. And through that, they learned about the specific economic and social stresses that their families were facing under lockdown. And the AEIO team in Colombia also used that data that they had collected on an annual basis to review families' access to technology. And then they also had teachers that remained in touch with families throughout to understand their needs. And a third theme, so based on what innovators have heard through assessments, they then adapted and created new contents and new delivery strategies so that families can continue to access their programming. So with an example from the AEIO team, they adapted their curriculum for remote delivery, used video conferencing and phone calls with children and families to support children's learning through play at home. And then they also rolled out a digital platform to support teachers and families. And then in Lebanon, Anna Accra sends many lessons videos using WhatsApp on a weekly basis to families. And they also distributed physical play kits that families can use at home. A fourth theme is that innovators made sure that they maintained ongoing connection and communication with families and used that as a way to incorporate their feedback so that they can continue to adapt and refine their programming and better meet the family's needs. So the RTCCD team in Vietnam, they held ongoing phone surveys with families to ask about how they're engaging with the digital materials and what types of challenges they were facing due to COVID. And they used this information to continue to adapt their response and programming contents. And finally, so even as innovators created and delivered their COVID-19 response, they sought to understand the longer-term strategic value that helps advance their early childhood development's mission to help communities build back better. So for example, Anna Accra, their response to COVID helped them deepen their relationship with Lebanon's Ministry of Education, and Mobile Crash in India developed new relationships with donors, partners, and coalitions that help strengthen their long-term capacity to promote ECD. And for all the teams, now virtual programming is now a part of their scaling up plans. So yeah, thank you very much. And thank you to all the innovators who shared their stories for the brief. I'll put the link to the case brief in the chat, and I invite you to read their stories in further depth and learn more. Thank you.
Thank you so much, Jasmine. That was a really useful overview of some of the lessons from the innovators. I do know that the Saving Brains Learning team and with James and others at LEAD did further research into this topic to understand what kind of models can we look to understand how we support children in adversity going forward. So James, I'm turning it over to you.
Thank you, Sanjana, and thank you, everyone. You know, hearing from all of you and seeing you, it does bring for me a certain energy of hope in what is, for the human family, still a very hard time. The topic that we're discussing today, the world of COVID-19. I'm going to try to share the screen here. So just as Sanjana said, thank you, Sanjana. We did the work that Jasmine described with 4 innovators, and we're really very moved by the power of their response. You know, when a crisis like this happens, which basically shuts everything down, it's natural enough and in fact essential for everybody to be looking to, well, how are we going to sustain our program? How are we going to sustain our staff? How is everyone going to stay healthy? How is this going to be economically alive? And certainly people did respond to those needs. But what was so striking was the way all the programs we worked with looked at, well, what's happening for our community and how is our whole family, so to speak, going to make it through this, not just how our program is going to make it through this. And that connection to the community created, as we saw it, a kind of resilience. And so as you can see, the head slide here talks about an emerging framework for resilience that we wanted to understand better. And so as Sanjana said, we expanded from the 4 case studies that Jasmine described, 2 of whom you've heard directly from today, and I think a very inspiring way. So we expanded it to 20, and we just wanted to understand more about what was going on. It was clear to us that although this was a crisis, that there was also very powerful and important work being done within a crisis environment. So this slide quickly sketches our discovery process. We work with partners based at the True Point Center and with, for example, the International Society of Social Pediatrics and Child Health, ISOP, and Grand Challenges Canada and Porticus, the HEA Humanitarian Education Accelerator. We worked with our network of partners to identify examples on the ground where people were doing valuable things in response to COVID. So this is in no sense a representative sample. This is a purposeful sample generated to try to find out from people who were responding powerfully according to our network context what they were doing, with the idea that we could share and learn from that. By doing that, we did this in low and middle income countries on all continents, and interviewed the leaders of each of those initiatives, 20 in all, and created case profiles, which are available on the website linked here. And Sanjana, I think you were going to share the resource website. It's easy to get it. Share it in the chat as well, or if people have these slides. So if anybody is interested in the profiles, it's a very rich and inspiring story. We then did a thematic analysis and looked for what's in common across these 20 and what we can learn from the diversity. And we created a framework, which I'm going to share with you the very next slide. But before putting that framework in kind of the form it is today, we shared it further with members of the Saving Brains community in one workshop, and then in 2 additional workshops, we went back to selected innovators whom we had profiled, whom we had interviewed, and said, this is what we're seeing from what you told us. Is this right? And if it is, or even if it's not, can we dig in a little more and understand the dynamics and refine it? So we did that as a kind of respondent validation and deepening with 2 further workshops. And then took all the results and synthesized them. And we've written up that synthesis, which is also available at the same website. If you're interested in details, I'm going to, with basically a single slide, try to share results for you in a few minutes, because this is obviously just a short overview. There's a lot here, but I'll try to do it in both a text slide here, and then a diagram will be the next slide. So I guess 2 slides. So as sketched here, we were focusing on local community level innovators, and found that they were responding not only to the need to sustain their services, but also to the threat to health and livelihood and life itself in their communities, and responding in powerful ways. The adaptations were very inspiring in their diversity and power, from things like moving to radio programs to engaging with artists and musicians and cultural leaders, to new technology innovations. There was a resource mobilization, a connection, and almost a sort of a lifting up within the community to create these responses with people on the ground, and just a capacity to see the wider picture that I think you heard already, both from PLH and from mobile creches and AEIO2 today. It's not this morning for everybody, though it is this morning for me. So we took from that this idea, resilience is a well-used term when we talk about individual resilience. But we decided to kind of extend that term to the idea of resilience in the provision of services, resilience in the organizations and programs who were doing the work. And one of our conclusions is that was deeply connected to community resilience. And so then the question emerges, well, how did they do it? What were the drivers of resilience? What made all this possible? And through the thematic analysis and this interactive work that we did with innovators, we came up with a broad structure, a kind of cycle of steps, which, although they're not exactly used the same way every time, they're to one degree or another present sometimes quickly, sometimes more systematically across the profiles that we studied. So this is a quick diagram of what we're calling the resilience cycle. And you can see if we start at the top, the little red triangle, crisis hits. It doesn't have to actually be COVID-19. That's one of the observations from this is that it's a resilience that can apply to other emergencies as well. Anyway, so a crisis or emergency hits, and one of the very first things across the board, you saw this in the live examples that have already come up, people connected to the families. Remember what Javi said, all the frontline workers talking with the we saw that again and again to understand what was going on amidst this crisis and how it created both challenges and priorities for community members. That was done both informally, everybody listening, and also through systematic surveys and through a constant connection and feedback. Using that to go on to the next, sort of around clockwise here, identifying priorities so that everything has been shaken up. What are some priorities at the community level that we need to be sure to act on right away? And as you know, the example of provision of food is a common one, but also stress and violence, as you heard from PLH, and the need to maintain mental health, the AEIO2's perspective offered on that. So priorities established, grounded deeply in the communities. And then the step 3, bringing to bear a wide range of stakeholders to sort of figure out how to do it. And we observe people working with very local community stakeholders, but also funders, national and international connections, find every avenue, remember mobile creche, finding sources of provision for food. Item 4, once you've got that together, actually building solutions. And we saw this whole range of creative solutions. I don't think I have time to give examples, but they were remarkable. And you've seen some examples. Those solutions were in turn enacted through a mobilization of resources. And I would just like to highlight lifting up community resources. So in the mining desert community in Chile, members of the community began weaving. It's cold, and livelihoods are threatened. Created a wool brigade to weave, little scarves and hats for children. So from the community itself, as well as nationally and internationally, and then put that into place very rapidly. You've got 6 steps, it sounds like a lot, but it happened fast. And so it couldn't be perfect when you put it in place, but it was there, and then they were all able to learn from it through feedback, entering the cycle again. So you have a learning cycle. If you look at the bullet points on the left, I don't have time to go through each of them, but I just mentioned one. This functions as a learning cycle. And I'd like to just turn now to the one at the bottom in bold, which came out so strongly as we interacted with each of these innovators, that if you ask what made this very complex and creative engine go in different contexts across communities, I think it was the deep respect that the program leaders and program frontline people had for the human dignity and agency of the people they were working with. They were connected at that level, and there was a genuine two-way interaction on the basis of dignity and respect, which made it possible for lots of other things to happen around this cycle and for a genuine response to crisis to occur. So I just want to thank, again, all of you, and particularly the people who did that and who shared those experiences with us, and through them, the people on the ground, the families with their children who are around the world responding to crisis, and I hope moving us toward a better time. Thank you, Sanjana.
Thank you, James. That was really useful. So this is an interesting moment, because now we're going to head straight into our discussion section, actually. And so, and I am seeing some interesting comments about both this, but also all the other speakers that we've had. So maybe I can ask all our panelists to share video now again. And maybe what I can ask is also if we have any specific questions. I see some questions coming in the question and answer section as well. So I'm happy to read out some of these questions to you all, and then see if any one of you all are able to answer. Feel free, any of the panelists, to answer them as well. So I think the first question is from Ramdhani, if I'm not saying your name wrong, which is really just thinking about the effectiveness of radio messaging. So, and Ramdhani, I know that there's been a lot of work that's already been, there has been work done that is testing the evaluation of radio as an effective medium to reach children and families. But curious to hear from our panelists if you all have any insights to respond to Ramdhani. Did anybody of you use radio at all? Yeah.
Well, if you want to, Sanjana, I can comment on this one. We didn't really made a study on the impact of the radio that we used during the pandemic, but there has definitely been, at least in Colombia, studies made on programs to radio, education programs to radio, which have been really helpful, where people have been taught, I mean, this is not early childhood, but people have been taught to read, to write, and, you know, they have been very successful with older audiences. In our case, the material that we were sharing was mostly for parents, for adults, not for the children. So just like tips to help them better interact with children. We unfortunately did not, as I said at the beginning, we didn't do any study. But I know that, as I said, for adults, it has been, you know, a good strategy in the past.
So just quickly, one of the cases we studied, the Save the Children's First Steps program in Rwanda, which was a group parenting sessions program, parenting sessions over time, did a weekly radio program to deliver the content of those sessions through radio, and then followed up with phone calls from the frontline people, if you will, and found that to be quite an effective strategy. Also in Nigeria, another case example for National Breastfeeding Week, they turned what was in-person programming to promote breastfeeding into aspiring radio program. So there's a couple of examples.
If I may, oh, I'm sorry, please go ahead.
Can I go on, please?
Sure.
Sure. So
just very quickly, then we'll move to the other questions as well.
Oh, okay. I just wanted to add that the COVID-19 resources, parenting resources that we created were also shared through radio programs, but we haven't done a study to see if, to evaluate the impact of those specific ones. We did do a study to impact or to evaluate the impact of the resources, but it wasn't targeted at just delivery through radio. So, but we did share through radio as well.
I just wanted to share our experience with not so much it wasn't a radio program, but when the pandemic hit, we started.
Chitranjan, can you first introduce yourself and tell us where you're calling in from?
Okay, yeah, my name is Chitranjan Kaul. I am the director of an organization called Foundation for Communities of Learning, based in India, and used to be with another organization called Center for Learning Resources earlier. And during the pandemic, soon after the pandemic started, we started a program called Sajag, which was essentially intended for messages to reach parents, which would acknowledge their distress, which would acknowledge their straitened circumstances, and provide ways in which they might find the emotional, some level of emotional stability in which it would be reasonable to expect them to give some care to their children under those circumstances. That program, we used WhatsApp primarily, and we used the state's Indian government's program called ICDS, which to reach the parents through the entire government system. And it by the time we ended in March, it was reaching about 2 million families across the country. And I think one of the things that we recognized was that we could have done the same thing through radio as well, which is why I'm raising this at this point. But we found the WhatsApp useful because lots of people had access to it, and there were people actually who didn't have access. That many people didn't actually have access to radio because people have thrown their radio sets away. But I think the more important thing was that we arranged for post-messaging conversations with communities and parents and so on about what the import of those messages was. And that was very, very effective and made a big difference to a whole lot of people, and their own comments on that were very, very gratifying. So yeah, I think the audio, sorry, yes, please.
Ranjan, can you just quickly share about the systems comment you made in the chat as well, just very briefly before we move on to other questions?
Yeah, just wanted to ask the question of the resilience cycle that was presented. I just wanted to ask, and it's a critical thing. Organizational resilience is an extraordinary question and wonderful to explore. But to me, resilience always suggests the ability to get up after you're down, when you've experienced extraordinary hardships, and then you're able to stand up again and get going. This cycle, it's a description of a very effective program planning, etc. But there is nowhere an example or a step which relates to how you get up after being down. And to that extent, I wonder if there is something I'm missing when it's being called resilience cycle.
Thanks,
No, I don't think you're missing. Thank you very much for the comment. It's not so much that the organization was down, it was that both the organization and the communities were hit with a crisis of such magnitude that they were in trouble. People were having a hard time getting enough food to eat, still are, but there was a bounce back from some very extreme stress. To your point, I think if you want to, you think about it as an organization that had, and a community that had inner strength, and that it's really about adaptation to a crisis, rather than being completely at a phase when you can't do anything. If there was a phase of paralysis, it was responded to awfully quickly. So I hope that's helpful. I don't think I think what you said was insightful, and I think is seeing clearly what was happening.
Thanks, James. Thanks for that response. And thanks, Chitranjan, for your comment as well. I think it was a really useful comment. And I have a comment. I have a question for Anna, actually, which I think might be good to you to get your perspective on, Anna. I'm curious from your review, what did you think that the research community should do differently, to prepare for, say, the next emergency or the next, I'm curious to hear from you on that.
Thank you. So this is a big question for sure. I would say, if I had to say one thing only, is to make more concerted efforts in terms of what to research and how to apply in policy immediately, because I think the pandemic was such a big stimulus to conduct research in all areas, right? And then for the academic world, it was a boom, it was an explosion of motives. But I think in terms, if you want to get practical, if you want to get results, we need to understand that a lot of information we already have, and like how to apply in terms of implementation science efforts also, I would say that is the main, and also honestly, after seeing what happened in my country, in Brazil, as much evidence as we have, as much compelling evidence as we have in terms of political will, I think that is the main issue to address in many cases. Yeah, I'm not sure if I answered your question.
I just realized I'm on mute. No, absolutely. Thank you so much, Anna. And I'm curious, I think we have time for one more question. I don't know if somebody has another question. I think, James, I think you've answered some of the questions that both Mark and I can't remember who else had asked in the chat. So I think that was great. So maybe I can just ask Chavi another question, or Shekfi, do you want to ask Chavi a question?
No, but I'm wondering, in the Q&A, we have a question from Mark. And Jasmine, I'm curious whether you're able to take that. Where it says it would be interesting to understand the leadership culture, values, and organizational culture that promotes this type of innovation. What was assessed? What makes one organization more innovative? How do we cultivate this caliber of leadership to respond in this way? I would be also interested in an organization that facilitated the formation of community peer groups or play lab hubs for parents, caregivers that promoted community level solidarity and resilience.
Thank you, and thank you for reading it. I was looking at the chat, not the Q&A button. When you asked, it occurred to me I needed to open. Those are very thoughtful questions. I think the style of leadership that we observed here is a very collaborative one, built more on listening than on any kind of top-down methodology. And the organizational cultures were flexible, nimble, agile is a word that's sometimes used, as opposed to just holding tight to one way of doing things, willing to experiment and indeed to be playful.
Great, thanks, James. So I am conscious that we are running out of time for this webinar, and I think we've put out a few really important points for all of you all to process and digest. At this stage, unless Shekfi, you have something else that you would like us to do.
No, I'm really excited about this next part because we get to unveil and launch the COVID-19 platform with everybody. It's something that, we've been working with Grand Challenges and our partners at Harvard and Stellenbosch for the last year to develop, and it's my pleasure to introduce my colleague Jackie Delstra, who is our communications lead, to sort of give us a little bit of a tour of this platform, and we hope everybody will use it, and we welcome you to share your resources as well. So Jackie, over to you for the last couple minutes.
Hi, everyone. Yeah, I'm going to very quickly talk about our COVID-19 portal. Shakufi, maybe you can put the link in the chat, or I can try and do it quickly after I present. So this was created in order to share all the wonderful resources and research that were identified during the scoping review conducted by ECDAN and Saving Brains. There, within this Global Knowledge Hub, there's over 400 research papers. People, when they come to the hub, are able to search. You can put in an open search term such as mental health to find research that fits kind of that area. You can search by country. We also cataloged all the research studies by nurturing care component. As you can see, Shakufi mentioned a presentation, most of the studies so far focus on health. There's a clear lack of studies in some areas, including responsive caregiving. So by categorizing this way, it can help to show where the focus has been on research and what is still missing, or where the research gaps are. In addition, you're able to contribute to this Global Knowledge Hub, and we know people have been sharing resources and are aware of research, so we invite you to kind of contribute the resources that you know of. Once something is contributed, it's looked at by the ECDAN team, then approved to make sure it's relevant to be included on this site. You're also just able to, explore the various research studies that are included here to kind of just see the breadth of what's been included. So we hope this will be a great resource for individuals to see the existing research and help identify gaps, and also continue to be a living resource that people are to contribute to. So we're excited to, as Shakufi mentioned, debut this today, and I hope that we see great usage and the community continue to add resources here, and that this can be a great resource going forward for the community. Thank you.
Great, thank you. Thank you so much for that, Jackie. And I think just to wind us down, I'd like to invite Elizabeth to share some reflections and some possible, looking forward, what can we do together? If you have any ideas for us, Elizabeth, I'd invite you to join us now.
Thank you, Sanjana, and it's a great pleasure to speak and make some closing remarks. But first, I'd like to thank our partners, Grand Challenges Canada, Harvard University, School of Public Health, but also the University of Stellenbosch, and all ECDAN partners that have contributed to this effort. We embarked on this effort because we recognize the importance of learning from the COVID-19 pandemic, but also past pandemics. And this COVID-19 is not the last pandemic that we will have. So how do we strengthen our preparedness to respond to future pandemics, but also other emergencies? And we seem to be reeling from one emergency to the other in these current times. So we hope that we will take all this evidence. And of course, the key is, as was mentioned, is how do we translate this evidence so that it informs policies, but also I think informs the advocacy that we need to do so that in the future, in future pandemics and as well as other emergencies, that young children and their parents and caregivers are not forgotten. And as we know, they tend to be the last to be thought about, but they are the face of these emergencies that we have. I think what came out of the discussions, this very rich discussion, is the importance of innovations, agility, continuous adaptation, and continuous learning. The willingness to experiment and do things differently, because we know business as before is not going to help us in any way. The other issue that came out of this is how do we build systems so they are resilient? And James shared the resilient cycle. that values human dignity and respect. We should not be pushing solutions that we want, but we should be listening to the communities as to what they need and make sure that they own these solutions, and we're learning and working in partnership together with them. But another issue that came out of this is addressing inequalities. The research was mainly in developed countries and not in the low and middle income countries, where it is also very much needed. So how do we make sure that we actually do things differently in the future? There clearly wasn't also a lot of research that addressed rural populations that often don't have access to the digital technologies that people in the urban areas have, the poor families who can't afford cell phones, but also children with disabilities and other developmental and learning challenges. How do we make sure that our research is inclusive and inclusion to address the children that are often left behind? I think it's quite clear that we need to work together to identify the knowledge gaps that remain, but also the long-term impacts of COVID-19, and perhaps the need to have much more focus on longitudinal studies that we can study the effectiveness of the responses we put in place, but also the longer-term impacts. And then finally, I think the importance of learning platforms. ECDAN has one, but there are many others. But how do we coordinate and collaborate and learn together as we go forward to address and keep the knowledge translation going? Partnerships are crucial. I think that also came out of this discussion, and building those relationships between the funders, the researchers. And often what I hear from policymakers is that researchers don't always address the knowledge gaps that they have. And therefore, how do we make sure we are listening to policymakers as well, so that we can make this world more resilient, more responsive, and we also look at the systematic causes of these emergencies and so on, so we're a much better prepared world in the future for our children. So thanks everybody. This was a wonderful discussion. Our learning series will continue, and we look forward to learning from the other researchers as part of this. So thanks everybody.
And thank you, Elizabeth, for that beautiful summary of this session. I think lots of us have lots of questions still. I can still see some questions coming in on the chat. And I suppose this is where we need to keep connected using the resources that ECDAN has put out as well as the Saving Brains community, which is available for any of you all to reach out to, and we can see how we can keep talking and communicating and collaborating together. Thank you, everyone. I think we will let you all get back to your days, and we will be in touch. You will receive the recording and the slides over email shortly after.
Thanks, everybody.